Hi everyone, it's Marie Matter from the Australian Baroque Riding Academy. Just want to let you know an update and bring you along the journey as we treat a school horse here, Tui, for a SCC, which is basically like a skin cancer that he's developed in his eye. Now, how we found out about this skin cancer is for quite some time. You may or may not notice that he's been weeping from one of his eyes in particular, and we've been treating it as allergies. But in the last, I guess, month, he's come up with a lump in his eye, and I'll show you in the next part what that looks like. And unfortunately, that is a skin cancer. So I'm going to bring you along the journey from diagnosis to hopefully cure. The situation is what it is, and there's nothing we can do about it now except take the vet's advice, and then I'm also going to supplement his diet with herbs that have said to help really well with SCC, so squamous cell carcinoma. So bit of a sad post, but Tui's okay within himself, so we're hoping for a good outcome from all of this. So on Friday he's going to have cryotherapy through an injection into his eye, and I've gone and bought him a non-plastic fly mask, and that will also stop the sun from getting onto his eye and the other horses sort of, getting in amongst his eye and licking it, or him rubbing it on something. So watch this space. I'll pop up some websites as well of where I've found the herbs, and we'll just follow along from operation to rehabilitation and then back in the school. So please watch this space and I'll bring you along the journey. So here's Tui eating, and you can see a little white dot in his eye, and here's a photo of the white dot. So that white dot is the cancer that you can see. So thanks to McDowell's Herbal, they've got a squamous cell carcinoma program. And so it's for horses, and it consists of 3 products aimed at targeting the carcinoma from all angles. So, they target aspects of the immune system, and they also allow the carcinoma, the system that allows it to develop in the first place, and, really helps them topically and internally. So, up to 50% of the cases involve the eye that they've found. So we're hoping that this is going to help. What is a sarcoma, you may ask? So it's like a mass in the eye. It can be on the eyelids or in their third eyelid, but in this case it's in his eye. So treatments vary depending on the size, but can include surgery, chemo, radiation, or cryotherapy, and it's important to catch it early. So it can come from sun exposure, from genetics, from the UV rays, which is sun exposure. So there you go. This is Tui tonight, the 18th of November. He's not looking very well. He's not looking very enthused in the arena. So we're not really happy with how he's looking. So we didn't make him do a lesson. And this is part of life. It really is. So the next update will be the operation day on Friday, so stay tuned for that one. Bye.